Welcome all. In this video I talk about Crohn's disease and what type of Crohn's disease. Firstly, Crohn's disease is a chronic illness, autoimmune disease. Immune system attack any part of gastrointestinal tract from the mouth to the rectum. Any part. But there are a specific area or specific type doctor found at the latest guideline can differentiate between different type of Crohn's disease. I will illustrate this in this picture. Firstly, I would like to mention symptoms of Crohn's disease. Symptoms of Crohn's disease, constipation more often occur. Diarrhea, maybe diarrhea, but also mucus, blood in stool, pus, urgency to go toilet, tiredness, fatigue, feeling unwell, loss of appetite, weight loss. This may cause malnutrition and deficiencies in يعني most of nutrients in the body. So you have to talk with doctor to get supplement to replace it. There are some of other Crohn's disease symptoms that such fever maybe occurs in the flare up, feeling sick, nausea, vomiting, joint pain, inflammation or irritation of eye, area of painful swelling, leg, mouth ulcers. Now I talk about different types of Crohn's disease. First type, ileocolitis. This type, most common from Crohn's disease, affects the end of the colon and ileum. This type affects ileum of small intestine part and also first part of the colon or cecum. Second type, ileitis, only affect ileum of small intestine, the most common type also, and this cause severe deficiencies in inflammation and deficiencies in vitamin B12, as this area is responsible for absorption of vitamin B12. Gastroduodenal Crohn's disease, this affects stomach and the beginning of small intestine duodenum, and it is diagnosed by gastroscopy or upper endoscopy and take biopsy for histopathology. Doctor diagnose Crohn's disease. Gastroduodenal Crohn's disease affect only gastric, stomach, and duodenum. Duodenum is the first part of small intestine. Jejunoileitis, this affects the upper half of small intestine, jejunum, and also ileum اللي هو second part أو lower half of small intestine known as jejunoileitis, upper part of small intestine and the lower part of small intestine known as ileum. Crohn's granulomatous colitis, this type affects colon only and is diagnosed by colonoscopy known as skip lesion. The doctor will enter the colon by the colonoscopy, can be diagnosed or by histopathology and biopsy. This affects only colon, but the picture of ulceration different than ulcerative colitis as skip lesion, Crohn's disease. Last type, known as preanal Crohn's disease, cause inflammation around the anus, and this type local treatment may be effective in this type, such as corticosteroid, enimacort, or duodenphalt foam, or colifoam, or bentaza enema, or bentaza suppository. Thanks all. Subscribe channel for more videos. I will talk up in next videos inshallah about protocol, new protocols for treatment, new guidelines for treatment, and the specific diet which cause inflammation, which trigger inflammation. Subscribe channel. Thanks all in the end of the video.